Hello, my name is Barry Fleming. I'm a senior leader with the Healthcare Experience Foundation, and I'd like to thank you for joining us today on our webinar for Back to Basics, Relationship Rounding to Drive Outcomes. What we've found is that trust and leadership remains a key driver of clinician and physician engagement. However, as a key practice to create positive outcomes, rounding remains elusive for many of our healthcare leaders. So today we're going to provide some insight on how to elevate your leadership rounding practices to boost engagement, retention, and patient experiences of care. So here to share these practices with you is Katie Owens, the co-founder and president of the Healthcare Experience Foundation. Katie makes it her mission to see that every organization has access to resources for developing their workforce to achieve results. And prior to Healthcare Experience Foundation, Katie served on the HealthStream leadership team as vice president of the Engagement Institute. She also served on the Baptist Healthcare leadership team in Pensacola, Florida, where she supported the team's sustained journey to excellence. So if you haven't had the opportunity to hear Katie speak at the Barrel Institute, ACHE, HFMA, or the Cleveland Clinic's Empathy Summit, you will have the opportunity to hear her today. So thank you again for joining us. And now I'm going to turn this over to you, Katie.
Great. Thanks, Barry. Hi, everyone. Good afternoon. And in some instances, good morning. I know we've had tremendous interest in our live session and our on-demand real-time recording. As it so oftentimes happens, we make the best plans. And our colleague, Kathleen Lynham, who's an executive coach, is unexpectedly on a plane. And so we have had the opportunity to brief on our plans for the webinar today and share with you the leading practices that we're seeing across the country through our work at the Healthcare Experience Foundation and through our work at PRC, or Professional Research Consultants, as the consulting division of their nationally renowned measurement systems for patient, employee, and physician engagement. We're extraordinarily fortunate at Healthcare Experience Foundation and at PRC to have renowned coaches based all across the country who have walked in your shoes, who have served as chief clinical, nursing, medical officers, learning and organizational design. And so as we have really taken a close look at helping organizations restore their focus despite the ongoing concerns of staffing, stability, medical staff, engagement, resiliency, creating more consistency in the patient experiences that we're creating, we have really studied what I'd say sort of the tectonic shift we're experiencing and our need to refocus our rounding efforts. And so we're excited to share those practices with you today. So we have three goals in our time together today. First, we want to review some of the common pitfalls that we're seeing, especially in the last 12 months with regards to rounding, share strategies to make relationship rounding a differentiator, and then preview some enabling best in class, let me find my words today, folks, to hardwire relationship rounds. So one of the most important things that we like to do as a coaching practice is reflect on our own learning and our own experiences as of healthcare leaders, especially as you think forward in terms of restoring your focus and goals over the next 12 months, 12 to 36 months. And so I would ask you to think about, and if you're able to chat in or message me, that would be phenomenal. Reflect on two instances. A time when rounding has served you well as a leader, whether that's you're a senior leader rounding on departments, you're rounding as a one-on-one capacity with your employees, your medical staff, or your advanced practice providers, or your patients. How has rounding strengthened you as a leader? And what was a time when you felt rounding was amiss? It went poorly, you felt ill-prepared, you felt that you were blindsided, you felt that you might have been previewing some of the pitfalls when you just sort of left that conversation a bit disheartened. So if you can chat those in, I see some good friends on the line today. Here we go. Danny, thank you. Rounding helps you connect back to the why behind the work that we're doing. Absolutely. Leadership can be an extraordinarily lonely place. And so rounding can help us reconnect to that purpose. So keep those coming in. I've I've got this open in part of my monitor here as I present today from South Florida. Have you experienced any of these challenges with your rounding? So these are some of the common themes that we're seeing in present day healthcare, because we all know rounding is in many instances from an employee and a physician and a patient experience strategy as longstanding or as treasured or sometimes missed opportunities as hand washing when it comes to clinical care. So you're now asking your leaders to enter rounding situations that require new or significantly different communication, agility skills, and follow-up. You're experiencing a high degree of leader variability, likely driven by the high degree of leadership tenure variability. You and your team feel too stretched thin for effective rounding. You're not seeing the connection between your effort and outcomes. And yet you and your team have, whether it's board of directors or trustee obligations, performance improvement objectives, the organization must move forward. And so these are all common situations that we have been responding with agility to support our partner organizations. So some common pitfalls. So if you can, take a look and in your mind, asterisk the things that you're seeing. Rounding becomes problem focused. You walk out into a floor, you walk into a patient's room, you connect with an employee, and all you start to hear about are the things that feel insurmountable to fix. How quickly are we going to have safe staffing? How quickly are we going to, restore our anesthesiology team to being more fully staffed? When are we going to get quicker response times for patient access? Or on the flip side, they feel kind of like there's a veneer. They feel glossy. They're more public relations focused rounds. When we see lack of follow through, I had the opportunity to observe a division leader of a national healthcare system round with a CEO, and they made some promises to return back to a unit and talk about an issue. And, they hit the next 3 crises and they weren't able to follow through. And so sometimes we want to hear and listen, yet we miss the connection to how do we put bumper rails around the conversation to make it manageable? And how do we create accountability for follow through? When we fail to coach, one of the common themes that we see in organizations, and I know we're trying to do a lot here and cover a lot of different aspects of or audiences for rounding. And so I'm going to touch on different nuances of those as we move through our conversation today. Leaders are so busy doing the task of rounding that they miss the opportunity, first and foremost, to reward and recognize the staff that get positively mentioned, the teammates that get positively mentioned through employee or physician rounding. They fail to coach to the developmental opportunities that get uncovered in rounding. So we do the task, we just miss that process or leader as coach mentorship component. Misalignment to our patient, physician, and employee engagement results. This is a huge disconnect where we round on certain things that may or may not be key drivers or dissatisfiers to these distinct populations. And so those drivers of excellence can really be the GPS or now Chat GPT, so to speak, to our rounding efforts. Focusing on the task versus the person. We get so bogged down with the mechanics of, for instance, with patient rounding, asking about pain control, validating things like hourly rounding and bedside shift report, which we could have a whole nother conversation around the degree to consistency we want these things to be happening, yet the reality with our current staffing levels that they are happening. And we miss the element of the human connection. And this is where, Danny, to your point earlier, we really get the chance to restore our focus as people caring for people, not taking credit for improvements. We see this time and time again with senior leader, employee, and physician rounding, where we make improvements and we may follow up one-on-one with the physician, the provider, the employee, or the department where we made the improvements, but we miss that collective practice of all the rounding we as individuals or as a leadership team did this past month, this past quarter. whether, we're kind of agnostic if it's a stoplight report or a monthly email or a weekly update. We tend to love stoplight reports because they're the most common practice of high performing employee and physician engagement organizations. That gives the total picture of the improvement initiatives. Counting the hallway conversations. We see this a lot, especially with employee and physician rounding. We count the doctor caught me in the hallway, the employee dropped by my office and asked for these things as a meaningful touch base. And then not connecting with the department leader. I experienced this firsthand as a health system leader, where a senior leader came and rounded in my department, and employees were, some of who I may not have recommended to take their feedback firsthand, were suddenly overwhelmed with ideas for improvement. And had I been a part of that conversation, could have helped navigate, gosh, this is feedback from Joanne. She is such a high performer. When she connects with you and when you're rounding in my department, things that she says are going to be really important. And oh, by the way, I just want to make sure I've been managing these ongoing requests from Barry. If you hear these things come up, I just want to make sure that I'm on top of it. And so that alignment with department leaders and medical staff leaders is so extraordinarily important. We also know through our work at PRC that creating loyalty is really grounded in the fundamentals of people caring for people. And so these are the national key drivers of excellence of PRC's database for patient, physician, and employee engagement. So what do patients want to see? What are the most important predictors of loyalty for patients and their likelihood to recommend us? First, they want to know that they are cared for by a team that works well together. They want to know that they are treated in a safe environment. And we kind of take safety for granted when we narrate our care or make our caring visible. And they want to feel that the people they encounter treat them with courtesy and respect. So these are important levers to calibrate your patient rounding. With physician engagement and loyalty, which we know is an important driver of not just willingness to recommend, but also economic and volume-based growth, physicians want to know when they practice in an organization, whether it's in the hospital or the medical group, that the patient experience is a cultural top priority, that they feel administration is responsive to physicians' voice, especially with concerns and complaints that they may be encountering or those barriers to practice. And they want to feel that their patients are cared for with strong nursing care teams or medical assistant care teams in the treatment of patients. And with employee engagement and loyalty, and we asterisk this because many times key drivers are pretty enduring, and we've seen a lot of enduring nature of these key drivers over the last several years. But for employee engagement and loyalty and willingness to stay in an organization and feel fully engaged, new for this year and in the past actually 18 months, is that employees feel support during times of change. And so this is absolutely integral to include in your senior leader and your employee rounding. They want to feel a sense of trust in senior leadership, that there's strong communication between departments, and that employees have access to training and resources. And I know many of you are sitting on the line today to say, with our current staffing levels, how do we add access to training and resources? And yet for employees, they want to feel that they're invested in. And so we wanted to ground our conversation today as we dive into best practices for each of these areas, is that how we ask empathy-based questions in relationship rounding helps us create higher degrees of alignment, engagement, and retention. And these questions can really help us jumpstart this. And so we have refocused all of our curriculum and solutions on relationship rounds to help you re-engage your workforce, create warm welcomes for staff. And we could do a whole conversation around best practices and rounding for agencies, travelers, and locums. And so message me if that would be helpful. Foster quality, safety, and experience outcomes, because we see in many organizations that as employee engagement falls, as physician engagement falls, as we start to see decreases in our culture of safety survey results, then we start to see decreases in our incident reporting, and we start to see increases in concerning safety events. We focus on culture, coaching and mentoring using rounding to support stay interviews and rescuing resignations. Oh, Siri's trying to help us this afternoon also. Exploring and mitigating resignation risk for employees and physicians, and our new streamlined application with PRC that we're launching, relationship rounds new in 2023 to automate this approach. And so when we look at relationship rounds for senior leaders, the key outcomes that we expect to see are improvements in workforce and physician and APP engagement, improvements in retention rates because we're supporting managers, we're showing that team alignment, we're building trust. We expect to see improved patient experience results. The relationship rounding differentiator here is that executive teams, and this is pretty parallel for rounding on medical staff, is that all senior leaders are involved. Departments are assigned, and executives have the opportunity not just to represent their areas, also represent the entire executive team. If we know trust in senior leadership is a key driver of employee loyalty, if we know on the physician side that, and I'm foreshadowing my slide in a few points here, is that administration trust and responsiveness is important. We're consistent in our messaging, where all senior leaders are messaging with the same talking points. We've all practiced for the tough questions. We're all asking the same questions. The key next steps are executive teams then have protected time on the leadership team calendar. They review the trends that they're hearing. And they're also defining whether it's in a stoplight report or other follow-up communication. Here's what we're doing based on the information that we're receiving. And another differentiator here is the department leader gets the win. If I am the director of the cardiovascular unit and my staff, and this is a true story, my staff have been frustrated with the ice machines broken and they keep having to run up and down to the next floor. And then that senior leader walks in and in a signature of a pen stroke or submission order, fixes that ice machine that manager has been dealing with. All of a sudden you are hard coding for your employees that department leader doesn't have the local authority, and that to get something done, they have to bypass their leader and get to a senior leader. I'm covering these at a fast pace here, so please jump in with any questions. When it comes to employee rounding, one-on-one intentional conversations, and we have libraries that we can send, the key outcomes here are employee retention and engagement. We also tend to see byproduct improvements with patient experience and quality and safety outcomes. But we are really looking right now in all of our training and resources on employee rounds. How do we stabilize our workforce? The differentiator here is we are reconnecting with our employees. We are acknowledging the stress, the frustration, the compassion fatigue that's happening. We're focusing on our leadership compassion. We're focusing on specific strategies for travelers and agency team members. We're focusing on specific strategies at key vulnerabilities for turnover, how to ask questions that help us predict more opportunities to retain those employees. And so those next steps, and again, common practice here, stoplight reporting, there's leader accountability, especially if you're performing below the institutional or the national norm for employee engagement. For submitting rounding findings, you're teeing up your employee rounding to your senior leader so that they feel equipped for their senior leader rounding. So there's a whole ecosystem to relationship rounds. With physician rounding, specifically here, we're looking to advance physician and advanced practice provider loyalty and engagement with our organizations. We want physicians and providers to say that working here is an excellent place to practice, and it is an excellent place for our patients to receive care. The differentiator here is we are also leveraging the full depth and breadth of the executive team. We're making assignments based on high priority medical staff. If you're looking to grow referrals, if you're looking to stabilize your primary care or specialty networks, if you're seeing higher degrees of turnover in your advanced practice providers, we get really myopic in terms of the levers that we pull to address outcomes. And the key next steps here are a lot about accountability and communication, stoplight reporting, communicating and staying connected to service line leaders and medical directors of these areas. You're staying connected to your board, you're staying connected to your medical executive committee with what you learn. And with patient rounding, which is extraordinarily near and dear to my heart and our entire team, quite honestly. Here we're looking primary outcome measures, patient safety, and patient experience of care as a component of patient loyalty. We also know that we have opportunities depending on the patient's point of care in their stay. Differentiators of relationship rounding is to manage key milestones in the patient experience. And so if any of you have a goal around rounding on X% of your patients every single day, but you're struggling for outcomes, this is a huge opportunity to restore your focus and reduce some of the burden, because we can actually predict based on your patient experience results and your quality outcomes, which percent of patients you want to round on when. And so I was just with an organization that is rounding on 85 to 90% of their patients every single day, and they're in the 10th percentile. And so we refocus the how we round. We have targets for rounding with specific patient populations on their day of admission, at midpoint during their expected stay, and on their day of discharge or the day before their discharge. Certain goals are established for each of those intervals, and this is where we can all plug this into our relationship rounding solution. Day of discharge, we want that warm welcome. We know the peak end rule. Patients form heavier presence in terms of their recollection of memories on their first and last impressions. And so when we can make that warm introduction, manage up the care team, manage up the hospitalist, do any service recovery for their emergency department experience, or bestow credit back to that ED physician or provider and care team, this is that opportunity to set the tone. Midpoint in their stay, we're validating and we're course correcting. And end of stay or day of discharge, we're really looking for that overall care experience validation. And we're looking to make sure that patient has a safe transition home. We're looking to make sure that we don't leave any unresolved service recovery opportunities. And so I am extraordinarily thrilled, as we like to do with our monthly webinar series, to share new and exciting information on behalf of our leadership team with PRC and Healthcare Experience Foundation, our new relationship rounding application. Oops, sorry, I'm so excited I jumped ahead a slide. That will manage all levels of rounding with end-to-end solutions for establishing templates, for pulling in calibrated empathy-based questions to build the relationship, focus on the key drivers of excellence, manage insights, because we learn a lot of information through rounding, but also manage stoplight reporting and the closed loop communication and ticketing systems. And so you're going to be hearing a lot more from us at PRC and Healthcare Experience Foundation over the coming weeks and months. And so this tool is designed to manage rounding via internal or disconnected technology, where we're seeing frustration with results for leaders who are rounding but not maintaining meaningful feedback. So many times, like many of you can probably quickly assess if a leader's rounding effectively by looking at your application or any documentation that they have. This is an upstream solution to that. Looking for alignment between best practices and digital rounding technology, we can connect those roundings throughout the patient's stay or employee's tenure to look at those key milestones. Leaders are building actionable plans, and we're connecting rounding to patient, employee, and physician experience results. And this is a quick snapshot of personalizing success, because at the end of the day, everyone is doing some form of rounding. Most senior leaders attribute their success to rounding. And yet many times we might be, rounding successfully as a team, or rounding. Oh, thanks, Danny. But we don't round well together as a team. And we don't have accountability as a team from a unified approach that reduces unnecessary leader variability. Planning templates based on key drivers and visibility strategies, alignment of the apps. So the other challenge is many times apps drive rounding. We want the relationship to drive the rounding techniques. When we have competency validation and accountability systems in place, master coach certification, and our Healthcare Experience Academy and client portal libraries. And so as we're just summarizing our time together, we like to begin on time and always give time back. I want to invite everyone to our upcoming and to our knowledge first in class in healthcare, diversity, equity, and inclusion healthcare certificate program. We have 2 cohort dates established. So cohort 1 will begin August 3rd and conclude on August 4th. And then for those dates don't work well, our second cohort will be in the fall, October 5th and 6th. Today's webinar attendees will have discounted access if you just email insights@healthcareexperience.org. We can pass that information through to you. And this is just an extraordinary labor of love for our team. We believe it's timely, important. We focus on a 6-part curriculum of introduction to key terminology and topics for diversity, equity, and inclusion, cultural humility, foundations of emotional intelligence to support DEI, implicit bias, creating civility and belonging, and strategies for interpersonal and team-based inclusive leadership. So we hope to see you there. And I just want to make sure that we follow up today with, if anybody would like additional information on this program or other upcoming programs, just tag us in this poll. Barry, I probably just jumped ahead of you for launching this.
No, that's fine. Thank you, Katie. Really appreciate everything and that insight. It was wonderful. Again, that's we're here to be able to support our partners, organizations, any way that we possibly can. So just let us know how we can be of help to you. Either send something in the chat or reach out, and you can email us at insights@healthcareexperience.org.
Have a great day. Take care.